Sykes with Sykes Company, PA, along with Kathy Blanchard, who is our Senior Transition Specialist here at the firm. And we have some guests today with FDS Amplicare that Kathy will introduce in just a second. But very quickly, to give you an introduction to Sykes Company, this is part of our Master of the Margin series webinars that we have on a live basis. We encourage questions as we go through this process, and obviously today we have an extraordinarily interesting topic with FDS Amplicare and DR fees. So it's our pleasure to be hosting this today, and our pleasure to have Nathan with us. And Kathy, I'm going to let you do the introduction formally with Nathan.
That's great. Thanks a lot. Nathan, thanks for being with us today. Nathan received his Bachelor of Arts in Economics from Davidson College. He currently oversees the FDS Amplicare business lines, including Match, Impact, Restore, Connect, Assist, and previously served as the co-founder and COO CFO of Amplicare. Nathan has over 8 years of experience conducting Medicare plan comparisons and has launched the Navigate MyCare, the direct patient experience for the plan comparisons and communications. Nathan currently lives in Brooklyn, and Nikki shared with me earlier that he's debating on acquiring a new boxer puppy. So Nathan, we're excited to have you with us. I have been very impressed with several of your webinars that I've attended through the FDS platform, and we really appreciate you taking some time today to share this information on DIR fees and strategically working with patients to help them maximize that win-win opportunity between the patient care and the pharmacy DIR fee issues that all of us are dealing with these days.
Well, and Kathy, thank you for having me here, and thank you to everyone who's joining. And I guess I'll thank you again, Kathy, for attending another one of my webinars. And apparently, you're not tired of my voice yet, so
not yet.
So thank you. So as everyone knows, we're in the midst of AEP. But before we dive into everything we have today, I just want to quickly go over our mission here at FDS Amplicare and some other information that might be helpful. So our mission is to strengthen the health of pharmacies and their patients, and we do this through delivering innovative software. And what we're helping to build is what we call the new era of pharmacy. So that's going beyond just dispensing in the pharmacy. Now, you might have heard recently that we were acquired by Omnicell and will be a part of their Enliven Health division. So to give a little brief history for everyone here, you might have known us back in the day, and apologize for all the names, but back in the day we were at Medicare, then we became Amplicare as we added more clinical services for the pharmacy. Then we merged with FDS last year to have a more comprehensive suite of services through both front of the pharmacy and back of the pharmacy operations. And now with Enliven, we bring more communication and other benefits for our pharmacies, a very comprehensive solution. But today, it's everyone's favorite time of year. It's not the holidays, it's annual enrollment period. So we're going to cover a few things. First, just understanding general timelines of what to be aware of, and knowing that there's still plenty of time to help patients in your margins this season. Then we're going to look at specifically how you can do that in the pharmacy and with some opportunities we have, and finally the workflows we have available to help you at this time of year. So the first thing I want to make abundantly clear to everyone is that there is still plenty of time left in this enrollment period. So here, we're actually in week 3 of 7, or day 19 out of 54. And what's actually interesting is that a majority of our pharmacies don't actually start getting engaged with their patients until the beginning of November. Now, there's a few reasons for this. Sometimes it's because some of the, I guess we call it, the data is settling with CMS, so we make sure that we're doing all the QA on it. Some people change their PSAOs or have other contracting that they need to update. And something that we do that's unique is we can manually update that. So for example, if you're changing PSAOs in the upcoming year, but it's not reflected on Medicare.gov, we can manually update that for you. So That's what I talk about when I mean the data is settling down. But as we can see, the actual demand from our pharmacies and the patients that come in asking for help only increases drastically as time goes on. And my best answer for why that happens, human nature, procrastination. So everyone waits till the end. I actually had to set myself a reminder the other day. I helped my mom on December 7th last year. So I am in trouble for that, and I have to do better this year. But the point being is there's still a lot of time ahead. Now, something that we learn a lot from our pharmacies and their different strategies of how they help their patients. And it's all about spreading out the workload throughout the year. Now, some people think that improving your margins with plan comparisons is only during the AEP period, but it's actually year round. So we have this period right now where our pharmacies tend to help their non-dual eligible or low-income subsidy patients. And then after the enrollment period, they start helping those patients. And then in the first quarter of the following year, that's the Medicare Advantage Open Enrollment period. So that's when you can help Medicare Advantage folks. And then throughout the year, you can help your folks that are aging into Medicare. So the reason that you want to separate this is, again, just to balance your workload, because you guys have a lot of stuff going on right now with flu vaccinations and booster shots. But I think the real reason that I want to point out that this is a year-long battle, I might upset a few of you here, is because of these things. So your Medicare patients are a year-long battle to try and fight back against the PBMs and lower margins. So we'll see some opportunities that we generate for your store that help to increase profits at that time. But what I wanted to show you here is these are actually some advertisements that action committees put out saying that local pharmacies here on the right-hand side are getting paid too much. And I know all of you on here would disagree with that statement. But this is a constant battle, and we want to help you have the tools to fight back. And just to rub it in some more, here is more advertising specifically for any of you that might be calling in from Texas, because it is really trying to further decrease your margins. And for a little history, we first started on Medicare back in the day just to help with retention and patient loyalty in your pharmacy and keeping them coming back in just with all the plan changes that occur year to year. But we had to add new things that we call win-wins that we'll look at in a second to help increase margins after they kept getting squeezed over time. So here's some strategies for how you can help fight back. Now, the first one that we call are just our general win-wins, or these are just profit increasers. So what that means is that every year we get your pharmacy's dispensing history from your pharmacy management system, and we match it with the CMS information, and we pre-run plan comparisons for all of your patients. So this way, we can find the needles in the haystack that say, hey, if you help patient A find a plan that saves them money, it can also increase your reimbursements in the upcoming year just because of formulary changes. And so we do this by auto-detecting the patient's current plan and subsidy to find this information. Now, this infographic that we have on here is actually this is from last year. We just finished generating our win-wins for our pharmacies this year, and we found 93,000 win-win opportunities for our stores. So on average, that comes down to about 20 opportunities per pharmacy, with each one generating about $510 in increased profits for your store. So on average, that means $10,000 in profits that can be available by helping just 20 patients at your pharmacy. So, again, this is where we can focus on these certain patients either right now, and then again throughout the year, we keep generating these opportunities to help your bottom line. But it's not just looking at the pure profit increases that might come from helping a few patients. I'm sure all of you might be very familiar with this situation that we have right here, but just to generally say that plan comparisons can help mitigate fees from non-adherent patients. So this is an example here of how a pharmacy has a patient that is just habitually non-adherent with their statin. And no matter what this person's done to try and do MedSync or anything else with them to get them more adherent and thus help their bracket with DIRs, it's just not working. So this pharmacy had to pay an extra $24,000 in DIR fees just by being in the wrong bracket. Now, what we can help do is show you ways that you can improve your bracket for these patients that are non-adherent. So we call these next set of win-wins our DIR reduction opportunities. And basically what this does is finds the patients who are non-adherent but can save money by switching to a different plan. So let's say, for example, they are on a Humana plan, and we know that they care about the PDC scores. So this actually means that the patient moves, this non-adherent patient moves to a different plan. They're saving money. So you're making them happy, you're keeping them at your store, but also it's removing them from the plan, which is going to help boost your scores. Now, conversely, what we can do is find the patients that have high adherence, your rock stars, and they can save money by moving to, in this example, Humana. So that further increases your scores by having these patients migrate over to where there's win-wins for both you and the patient. Now, we've got a ton of friends and pharmacies in North Carolina. And so here's just one example here of one in Charlotte, where just by doing some of these actionable things with the win-wins, that they increased their profits by over $50,000 between a mixture of like DIR focused opportunities and profit increasers. And that's from 81 patients. So this person did a good number of comparisons. We have some pharmacies do hundreds, but just with 81 patients, that's about, over the open enrollment period, that's about one and a half a day. This is very meaningful for your business.
So Nathan, just a quick question. I know last year, my pharmacist took your software, reviewed what I was taking, and we did change plans. Very simplistically, he explained to me and showed me what the differences were. So in its most simplistic fashion, it becomes a win-win in my case for both me, because he showed me what the savings were, as well as, I would imagine, for the pharmacy. Is it always a situation where it's a win-win, or is it one-sided or the other?
That's a good question. So it's not in every situation that it's a win-win, but that comes down kind of to each individual patient and their relationship with the pharmacy. So we could think of, so basically there's three types of win-wins that we think of. So there's profit increasers, there's DIR reducers, and then there's these ones called suboptimal plans. And that basically just means that because of plan changes, this patient's now in a suboptimal plan and they're at risk of leaving your pharmacy. So, because of no action of your own, just the plan changes, you might lose that patient and their revenue. So what we do is we just find quickly some of the top opportunities to reach out to patients, but then you can do plan comparisons with non-win-win folks and see maybe there's another drug out there that's a therapeutic alternative, which we show in the application, where it can either be covered by the plan and pay the pharmacy more. So basically, we try and be as transparent with our information as possible to make every scenario a win-win if possible, if that makes sense.
It does. And anyone listening, we encourage you to send in your questions here on the questionnaire area. We'll attempt to answer these as we go through.
Thank you. Yes, we love questions. So on kind of that note of suboptimal plans, I just wanted to have some high-level network changes that I think are important to understand for this year. Now, we always recommend that you talk to your PSAO about any changes that occur because they work hard at making sure the contracting is right for their members. And they send communications out, but again, always reach out to them if you have some questions. But some specific plans I wanted to look at quickly are Exemplar is actually not a Part D plan that's offered this upcoming year. So some of y'all, if you were in the states that offered it last year, need to make sure you talk to your patients. Elixir is no longer a network for Elevate pharmacies. So definitely, if you're a member there, reach out to those patients. Clear Springs is no longer preferred on Atlas. And I also heard that they send out letters to all their patients saying that. So definitely talk to those patients to ensure they're not being pushed over to mail order or anywhere else. And then just one clarifying piece, any plan that had the name Express Scripts in it is now going to be crosswalked over to a Cigna plan. So I know all of these things are confusing, but that is why we are here to help, well, to use one term, navigate through all of this. Now, outside of these changes, our other suboptimal opportunities we mentioned relate to kind of larger industry changes that are occurring. So there's actually going to be 200 fewer standalone Part D plans this upcoming year. And the standalone Part D plans are going to increase their premiums by about 15%. So what this just means is it's still ever important to do plan comparisons for your patients to make sure they're saving money, they're in network for your pharmacy, and they can keep coming back to your store. Now, this could also be a time if Part D plans are getting more expensive that maybe Medicare Advantage is a good option for your patients, which for some patients, if they are financially more sensitive, it sometimes makes more sense. If they're in a more urban setting, it can make sense. And some Medicare Advantage plans now have some additional benefits that could be good for your pharmacy as well, such as they might have OTC cards that they give the patient every month. And so that's something where if they're now on it, they could be spending all that OTC money at your store, which is going to be higher margin opportunities for you to secure. And also we've heard from some studies that partners have done that Medicare Advantage plans reimburse for Part B better than original Medicare does. So that could be just another boost for margins right there.
And Nathan, we've got a question here from John, and he wants to know, does Amplicare calculate DR fees based on the pharmacy's specific PSAO agreement, as DIRs may vary from PSAO to PSAO?
So what we try and do is, so we do collect, this information from our network, and what we try and calculate in there is the conservative estimate of your potential DIR fee, because we don't know exactly how you might be performing, as it's very convoluted, as you well know. But what we do is we see the range of what is going to be occurring in that upcoming year, and we take the most conservative number for it. So let's say, just for example, if there's a plan that charges 15 to 20% on generics, we will take that 20% calculation when we run our numbers. Does that make sense?
Yep. And Jeff has a question: is this analysis you were just referring to included in your basic Medicare D membership?
Yes, it is. Yep. And we'll look at that and also some other things we include in just a second here.
And John comes back and says he's more concerned about the preferred, not the non-preferred consideration on his question.
So for DIRs, so we do
Yes.
break it down. We do break it down at that level. So if it is preferred or not preferred. But these are good questions. Keep them coming.
That's all we have right this second.
All right. So now that we've talked a lot of kind of the high level things of, the time period that you guys have to work with patients, why you need to be helping certain patients, and the different types of opportunities that are more valuable for your pharmacy, Now we're going to look at some specifics of how you execute on them. So our main goal is to help you be as efficient as possible at helping these patients. And right now, I know a lot of folks are busy with boosters and flu vaccines and everything, but we have the tools available to still help you reach those patients in time. Now, last year, we had our pharmacies help over 160,000 patients with plan comparisons. And what it basically came down to is the average pharmacy was helping about 54 patients, or 1 patient a day for the enrollment period. So our goal for pharmacies this year is to increase that to 1.5 patients per day, and we'll see how you can do that now. So the first thing I want to point out is that with what we've been building over the past 8 years, we've made a lot of intelligent recommendations in the application, and that's because we're the only plan finder outside of Medicare.gov that includes low-income subsidy and then finding the current plan they're on. Now, we've built a lot of pharmacy management systems only have the BIN, PCN, and group number stored on their side. So what we actually do is we take that and then we recreate what that plan could be for the patient. So we get that current plan. And from here, that's how we recommend certain plans for patients. Now, for example, you could have a patient that is a low-income subsidy or dual eligible, and they might be on a standalone PDP plan, but that's a huge risk for them because original Medicare, they don't cover that 20% coinsurance. So if a patient has a high medical bill, they can pay, through the roof in their costs. But there are things that we could recommend, such as a dual SNP, special needs plan, that patient could be on that can give more comprehensive coverage. So just the point of all that is that we help recommend plans for some patients to take the guesswork out of it. Now, the next thing we do is from analyzing your data, we can break the patients down into very specific cohorts that you can reach out to. So that could be based on adherence, if there's a DIR impact, top billings, whatever it is. And so this helps you find the patients that are most meaningful for your business. Now, for example, the case of Elixir that we talked about before, those are folks that you could find in our application and then reach out to make sure that they're staying at your pharmacy. Now, with the advanced filtering and the intelligent recommendations, we come together to create the win-wins and these other opportunities that are available for your pharmacy. So we try and find, the top 5% of patients that can drive profitability for your pharmacy, and then those who might be at risk of leaving just because these plans change something. So you want to reach out to them. Now, here's how you can do it very efficiently at your pharmacy. So with all of these opportunities, we have these letters that are automatically generated, and there's plan comparisons that are listed on there, tailored to your pharmacy and the patient. So what you can do is if the patient comes in, you can print them one at a time, or you can actually bulk print these very easily and just send yourself an email, let's say a 30-page long PDF, just print it out and then tell your staff, hey, you see Nathan coming to the pharmacy, just hand him his letter. And you know that letter could be recommending that win-win plan for to help both you and the patient. Now, another thing that we offer included in our base package is actually free text and call campaigns to patients. Now, we did this because we saw that a lot of engagement our stores had with patients was the patient coming to them saying that they needed help with something. And so this further lets your community know that you have the tools to help them. So we have 2 ways of doing this. One, we have our automated campaigns that can go out. So we can see on the right-hand side that they can send during the enrollment period during different times. So you can make sure that you're reaching them. And it's actually intelligent because if some activity is done, it's not going to reach out to them again. So it's not going to overwhelm your patients. Now, the second one that we have is more of a manual campaign. And this is where you can select specific patients, maybe done by that filtering we had before. And you can send a message to them, either text or you can record your voice and say, hey, you might have gotten this letter in the mail, throw it out, burn it, do whatever. Just come back into our pharmacy and we'll take care of you like we always do. So this is a very easy way to tell your patients to not go anywhere else and come to your pharmacy first. Now, the last way that our folks interact is with what we call our tool Assist. And so this is actually a widget that's on your desktop. And when a patient comes in, it'll see if they're eligible for an opportunity like a win-win and actually present a little pop-up on your screen that you can just click one button to print that handout. So just a quick print and then hand it to them. You can even, if you wanted, click it to single sign-on into your Amplicare account and then help the patient more from there. But at the minimum level, this just lets you know that, hey, this is a high priority patient. Let's take a minute or two to talk to them about their coverage. So when a patient gets a handout or receives a text message, it can tell them to go to our patient-facing site, Navigate. Now, a lot of our pharmacies actually do a fantastic job with enrolling patients just on the spot at the pharmacy. So they look, they do the comparison, the patient chooses a plan, and they can enroll straight from there. But we also, just as kind of another note, we really push online enrollments as much as possible, because kind of going along that graph I showed earlier of people procrastinating and trying to enroll at the end, if everyone tries to call the carrier or the call center at the end of the period, all the lines are really got a lot of traffic, so they might not be able to enroll. So we push online enrollments as much as possible to ensure that the patient gets in the plan. So nonetheless, what you can do right now is if your pharmacy is busy with boosters and vaccines, you can make sure that by giving them a handout or giving them a text message, they can go to Navigate and enroll from the comfort of their home, and it's going to be good for them and good for your store. Now, the way we do that is when someone logs in, they actually are automatically shown those win-wins. Or if you did a comparison with them, it'll show that comparison you did with them in the store. And so here we see that there's this recommended plan, and it gives them a little note explaining why it's recommended. It says, hey, we think this is good for you based off of your pharmacy and your prescriptions, but you can always click here to view all plans available. So that, again, there's more intelligence that's built in with this. In the application, we show tracking to make sure that you're staying on top of these profitable opportunities and are executing upon them. So just provide, again, more transparency. And now the last benefit that we have here is we actually have a new partner this year called Health Plan One, and they're an insurance agency. But the main reason for us working with them is that we evaluated the market and how some other folks used agencies, and we made something that's truly unique with them, where we have an ironclad agreement that ensures that they're doing the best thing for independent pharmacies, and their team's actually trained to use Navigate. So we have a dedicated team that basically, if a patient receives a handout and wants to call in to learn more, they can actually load their profile up and see what your network is, what their drugs are. They can see the win-wins to make sure that, again, they're doing the best thing for your pharmacy and the patient. So we like to think of our partner as just more human resources that are available for you, especially at this time of year when you're very busy. So for our pharmacies, a lot of them love to help with Part D, just PDPs in the store, and they're, that's fine. Keep cranking those out. But sometimes patients might have some more difficult questions, such as Medicare Advantage or Medicare Supplement, and that's definitely where Health Plan One can help out there. And that is all of my rambling.
So Nathan, obviously with this year being a special year with boosters and vaccines and flu shots hitting us all at one time here, and I go back to that chart that you showed a few minutes ago, it's obviously going to be an extraordinarily busy time here in the next month. And I think probably one of your words of wisdom here is don't let that last minute crunch get you, because clearly, again, with boosters, et cetera, somebody trying to get somebody on the line through the phones probably going to be difficult at best in the last few weeks. Do you think that's a fair statement?
I do, and I have some numbers too. So we heard from a call center in the past that overall, just in general, I think they had 42,000 inbound calls, and they could only answer 8,000 of them.
Wow.
So that is why we push online enrollments as much as possible. And also, here's another thing. What folks don't realize is that if they have to call the carrier to enroll in a plan, the carrier has to go through something called a CMS needs assessment. And this basically, I'm not even kidding you, there's like a part of it that's like a 10 to 15 minute long block of text that they just have to read off, like all of this information. So that's just, your patient is spending 15 more minutes just covering that. And they got to tell them their drugs again. It's a whole thing. And as I mentioned earlier, like Clear Spring Health sent letters to a bunch of patients saying just to use their mail order. So the carriers are going to push mail order as much as possible. So that's not a risk, again, if you're just doing it online and just enrolling through the infrastructure that we built.
Mm-hmm.
So if a patient were to log into the Navigate portal, is there a pop-up that lets them chat with somebody to help walk them through that process? Or is it just picking buttons and trying to find your way through it?
So there's actually two things on there. So right now, it will list the number if they want to call Health Plan 1, but we do have our chat bubble that's there, just like in our application, and that actually comes to our support team. So we can answer some questions there, but we've really tried to make Navigate as easy as possible to use. I know that Medicare is complicated, so we tried hard, but we file Navigate with CMS. CMS has approved it. We also go through accessibility testing so that it's accessible to any patient that might have a disability. We put a lot of thought into it.
And Grant wants to know, what is the best way for your pharmacists and techs watch this video if they had to work in the pharmacy today? And Grant, with you registering for the webinar today, you will be sent a link within probably the next 36 hours. It will have a link to the recording today. This has been recorded, and you'll be able to replay it to whomever, and as quickly as you'd like, and also as many times as you'd like. So don't hesitate to use that with everybody in the pharmacy, so they can learn what we have learned here today. I know I have learned some things myself as a non-pharmacist, things I did not know. I happen to be an exemplar guy, so I have learned that plan's gone. So I guess I need to drop by my pharmacist if I can get his attention, not doing boosters, and I guess get on his iPad or go do the Navigate. And what is that link, by the way, to go directly to the Navigate program?
So the website is navigatemycare.com, but the thing is, it's open to anyone on the public, but the key thing that our pharmacies provide on any handout or text message is instructions to access it with a unique ID. So we call it a customer ID. And once you have that from your pharmacy, you can just go in and enter that, verify your date of birth and zip code, and then that's what brings in all of your current prescriptions, current plan, your subsidy. So that's really the unique thing that we offer.
So if they don't have time because they're giving boosters, they just need to give me the code, and then I can do it myself.
Yes.
And that's the message that they need to pass on to their patients then.
Well, exactly. And it's not just you doing it by yourself. It's the way we built it so that it gives recommendations, or it gives those win-wins to the patient when they log in.
Yeah. And if there are any other questions, please don't hesitate to put them in. We've got just a few minutes here, and Nathan is certainly gracious enough to answer those questions. And Lisa wants to know, how do you get the code? I guess you get the code by asking your pharmacist for the code. Is that right?
That's right. It's on every handout. So they print a letter. It can be either a simple letter or we have types of comparisons that we do. So it could be a basic handout or a much more robust handout, but either one will have that code instructions on there.
Good.
Now, if it's a text message that we're sending out, it actually will have a link, and that link you can click that's already got the code embedded in it. So you just have to verify who you are and you can access it.
And Mandy has a question, says, is there a way to see your star rating or rating for DIRs on Amplicare?
So that's a good question. We do not show that in the application, but we also can help show some folks that are non-adherent, and if that plan cares about adherence. So that's what we flag as DIR impact. So again, we don't know your measures, but what we can find is the actionable things that you can do to help them.
Okay. Well, Nathan, I am not seeing any further questions here. We certainly appreciate you spending some time with us today and teaching us as to what we need to be doing here behind the bench and in front of the bench as well. And it's been our pleasure to work with FDS Amplicare in the process day in and day out. And I know you guys will have a busy next month or so. So again, we appreciate the opportunity with everybody being on the call today.
Well, thank you, and thank you for everyone who attended today.
Absolutely. And everybody have a great day. Take care.
Bye-bye.
Bye-bye.